The following is a community affairs presentation from the Ulster County Health Department. This is the Healthy Ulster Radio Show, a weekly presentation exploring community health and sustainability with guests representing a broad spectrum of community partners working to make Ulster County the healthiest in New York State. This program is sponsored by the Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network.
Good morning. You are listening to Healthy Ulster Radio. I am your host, Dr. Carol Smith, Commissioner of Health and Mental Health for Ulster County. With me this morning is my co-host, Ben Martello, our Director of Community Health Relations. Good morning, Ben.
Good morning, Dr. Smith. How are you this morning?
Fine, thanks.
Dr. Smith, we're here to talk about a very interesting topic, and it really affects a very, very wide segment of the population. And that is veterans' health and wellness, the services that are available in Ulster County, and the challenges that are faced by veterans when they return home with regard to health and wellness. And we have with us today Steve Massey, who is a U.S. Navy captain retired, and he is Director of Ulster County Veterans Services. Welcome, Steve.
Oh, good morning.
How are you? Steve, why is veterans health care so significant? I mean, obviously it's your agency, but why are we here today to talk about this?
Well, because I saw a statistic recently that troubled me, and I think presents an opportunity for area veterans in this county. And the statistic is this. There are about 12,000 veterans in Ulster County, but only about 3,000 of them are utilizing the VA's healthcare system. And a huge percentage of these veterans are or would be eligible to use VA healthcare, but they don't. Now, there are probably many reasons that they don't, but if one of them is because they don't know about it and don't know that they could, then that's a great reason to talk about it this morning, to get the word out and make sure veterans don't have a misconception about what's available to them and what it can do for them in terms of their health.
You also have transportation from the Office for the Veterans in Ulster County up to Albany to the Veterans Administration Hospital. So if transportation or lack thereof is an issue, you can help with that.
Absolutely. We run a minibus up to Stratton VA Medical Center in Albany every day, Monday through Friday, without fail. Whether there's 2 or 20 going up, we go every day. And the veterans who have their appointments up there who need transportation utilize it. And I would encourage any veteran who has perhaps a challenge with their transportation up to Stratton VA, or is considering Stratton VA and doesn't know about the hour each way in terms of viability, that's an option. And our minibus originates in Kingston, but we also operate feeder routes around the county to get veterans, for example, from the Ellenville corridor up to Kingston to get that minibus, or from the Highland area, or from the Route 28 Shandaken corridor. We try not to miss anyone, and so we operate that transportation network to get vets up to Stratton VA that need to go.
And there's local primary care available in Kingston as well, right? Can you
yes, there is.
About that?
Yes, there is. There is a Kingston clinic of the VA. It's a primary care clinic only. So there's one doctor there. I think there's one nurse practitioner, a couple nurses, and that's what they do. They do primary care. So things like immunizations, routine exams, probably most importantly, referrals, because if a veteran needs a specialist, an orthopedist, a urologist, anything other than what a general practitioner would practice, that's going to be an appointment in Albany, okay? And so the way they get that appointment is to start with the general practitioners here at the Kingston Clinic.
And are all veterans automatically eligible for VA health services, or does that vary by one's rank or length of service or what have you?
The short answer is no, not everyone is. And probably the most important thing you just said is automatic. Nothing with VA is automatic. You have to enroll. All right? The VA isn't going to knock on anyone's door or send them a postcard and say, how about enrolling? It just doesn't happen with the federal government that way. So, but the truth is, probably 80 to 90% of veterans would be. There are a few categories of veterans who will not be eligible according to the federal VA's rules. A few of those exceptions would be if you don't have an honorable discharge, If you have less than 2 years of service after 1980, before 1980, that rule doesn't apply. And for veterans after 1980, they also implemented an income limit. If you make more than a certain amount of money, based upon how many people you have in your family and so forth, the VA presumes you can afford your own health care. Now that constraint goes out the window if you're service disabled. Doesn't matter what your income is. If you're service disabled, the VA will always treat and care for those conditions. But so there are a couple categories of veterans who VA will say no, you're not eligible. But demographically speaking, the 12,000 vets in this county, I think probably well over 80% of those vets will not trip any of those exceptions.
And if your income changes over time, you can reapply?
If your income should go down, if you were a high income earner, let's say, and fell on hard times or for whatever reason, absolutely, you can apply as often as you like. There's no limits, and so if your life changes to that extent, yeah, absolutely.
And are Army and Air National Guard people, veterans, eligible as well?
The sad truth is no, unless they've been mobilized by the Federal Army, Air Force, Navy, mostly for wartime service. So National Guard and Reserves, the VA does not consider that military service for purposes of eligibility. Again, unless they were mobilized. Now, in the post 9/11 era, many reservists and guardsmen have been mobilized, and so their benefits have been triggered. But for those that did not get mobilized at some point, or for those who have come in recently and the mobilization tempo has gone down dramatically, they won't be eligible for VA health care because of that. On a personal level, I consider that to be an injustice. They're serving their country like anyone else. And so I'd love to see that change, but that would require congressional action to do that.
And what is the threshold for that? Is it one deployment or more than one? Or
all you have to do is all you have to do is serve one deployment for the amount of time you were ordered to go. So if you were ordered to go on deployment for 6 months and you served your 6 months, that you're fully eligible. If the only time you would not be eligible is if your deployment was cut short by your own actions, for example, misconduct or something like that. So as long as you served your time, you're eligible.
And how does one go about enrolling in Veterans Health Services?
It couldn't be simpler, Vince. It's a 2-page form, and it's available online. It's a fillable PDF. But we'd love to have the veterans come to our office and get as much help as they would want or need doing that for a couple of reasons. One, we're going to make sure they get it right the first time. Federal forms aren't always fun. So, but this one isn't particularly difficult. But we're also going to follow up and make sure it gets processed properly. And if there's any issues with eligibility, we're going to be able to tell them in detail what those issues might be, so they're not surprised by the outcome or they're not misinformed about what their eligibility might be. And
do you become an advocate for them if they have run into problems down the road?
We absolutely do. Mm-hmm. There's an appeals process for veterans who feel that they are eligible, but for some reason VA has said no, you're not. And if we feel that was an unjust decision, we actually will assist the veteran with an appeal.
Mm-hmm.
Yep.
And is it free to apply?
It is. There's no cost to apply, and certainly our services at Ulster County Veterans Services are of no charge at all.
Interesting. Mm-hmm. So, Steve, tell us a little bit about some of the major health and mental health issues, challenges facing veterans, and how they might differ, say, from the general population.
Well, I think probably the one that comes to mind the most would be the fact that our population of veterans in this area is very, very heavily concentrated in the Vietnam era. And there were good reasons why that's true, and it had to do with the fact that Vietnam was a draft. And every town and every state, the entire nation had their fair share of draftees. That's how it worked. It was very much a blind process by birthday where people were drafted. So,
and that was pretty much the end of the draft cycle, right? Vietnam.
It ended in, I believe, 73, 74, mm-hmm. Right. So anyway, because of the draft, there were so many more veterans of that era than of any other era now. I mean, World War II was heavy back when these fellows were still alive, but most of that generation have passed away. Korean War veterans are getting there pretty quickly as well. So an overwhelming majority of our Ulster County veterans are Vietnam veterans. And with that, to your question about health issues, is the matter of Agent Orange exposure. And so for your listeners that don't know this, Agent Orange exposure causes any number of diseases, and there are 14 that are considered presumptive, meaning if you have that disease, it's presumed you got it from Agent Orange. And there are some very, very common diseases that you might not think come from Agent Orange, but I'll give you the top 3. And they are type 2 diabetes, ischemic heart disease or blockage, and prostate cancer. So I think people have all heard how common those conditions are. And so Vietnam veterans suffer from those conditions disproportionately because of their exposure.
Interesting. And I would imagine I think we're now on 14 consecutive years of conflict, that there have to be a lot of veterans coming back or having come back with post-traumatic stress syndrome, with head injuries, with
substance abuse issues, depression.
Right. That's true, and we see them. Numerically, it's not large, and that's just because numerically that era of veteran isn't a large numeric population here. But for the ones that are here, it's pretty common. And post-traumatic stress, exists at varying levels. It can be in the background and not visible, but still there, or it can be, full-blown hot mess, the completely dysfunctional kind of impact on veterans, and it runs the whole gamut. And this is one area where I think the federal VA has a lot of work to do in terms of getting mental health resources more available to veterans. In our area, for example, there's one mental health practitioner at the Kingston VA clinic, just one, for the entire county.
Wow, 12,000 veterans.
Right. And Stratton VA in Albany has many more, but they also have a catchment area that goes all the way to the Canadian border. So I think that's an unmet need right now that the VA should be tackling.
I know we learned quite a bit about suicide with veterans, because that's one of the 3 highest risk groups, along with young people and older adults. And in talking to, we had a guy we did 3 videos in our suicide prevention app, the Speak app. One was a young person, one was an older adult, and one was a veteran. And in talking to the veteran afterwards, I said, it must be, the stress of combat. And he said, actually, it was really about relationship, because when you're out on multiple deployments, it really wreaks havoc on family life, and dealing with the financial issues, the relationship issues, and then on top of that, the combat stress issues. Right. That could be a really lethal combination.
Right, and that's been the unique nature of our post 9/11 conflict, and in the various venues that we have it, is that it's over and over again deployments. If you think back to our military history, we've not had that. World War II was about a 4-year war.
Right.
Vietnam, you served one year tour and then you came home, and that was it.
Right.
In today's volunteer army, if you stay in, you're going to go back until this asymmetric warfare stuff, we hope it simmers down someday.
Yeah, I mean, and it's really a constant state of war, so to speak,
right.
Even though it may not be declared.
So you're spot on that's a unique aspect of today's world and today's veterans and today's military. Yep.
But we want to hear more, Steve, about the health issues, and also about the services that your agency offers, and we'll be back after this short message.
In emergency care, it's all about experience. At Health Alliance Hospital Broadway campus, a member of the Westchester Medical Center Health Network, it's another way we're investing in you. We're board certified in emergency medicine, nationally recognized in stroke care, and use telemedicine to give patients access to the region's leading specialists. Patients tell us we make their experience exceptional by treating them with the utmost respect. Health Alliance Hospital Broadway campus. We're advancing care here. Visit HAHV.org for more.
Welcome back. You are listening to Healthy Ulster Radio. Our special guest today is retired Naval Captain Steve Massey, who's director of the Ulster County Office for Veterans Services. Steve, could you tell us a little bit more about the FAVOR program in Ulster County, which was rolled out a number of years ago as a joint initiative by the county executive and the county clerk?
Absolutely, Carol. The FAVOR program was designed as a thank you from county government, and as you mentioned, jointly rolled out by County Executive Mike Hine and County Clerk Nina Postupak. And it was designed to do two things: to put a card in the hands of county veterans, and to help promote businesses in the county, and in so doing, offer discounts to the veterans. And so there are about 200. Maybe more now, in the neighborhood of 200 merchants who specifically enrolled in the program to say, yes, we're going to honor our local veterans with a discount on our services and products. And I don't have any numbers at the top of my head about how many veterans have actually enrolled in it, but it's an easy process. You come to either the county clerk's office or our office with your DD-214, and you walk out with a card. It's that simple.
Oh, it's really a great program. I see those signs everywhere.
Yeah, that's a great way to recognize the service of the individuals in our county.
And Steve, we also know that there's another innovative program that's been up and running for a couple of years now, and we all participated in helping to promote it, but it was really a wonderful initiative to tackle the challenge of veterans homelessness here in Ulster County. Can you talk about that project a little?
Yeah, sure. We call it the Patriots Project, and it gave birth to what we now know as Patriot House, which is a home on Wirt Street right here in Kingston that is a transitional home for homeless veterans. Transitional meaning they're coming off the street, they need to be stabilized and case worked to resolve whatever is causing their homelessness so they can get into a stable housing situation. And so the county was absolutely breaking ground with this one, because you won't find a homeless veteran facility in a two-county circle anywhere around Ulster County. We are the only one that has one. And so we have had some out-of-county homeless veterans that have come over, but generally it's Ulster County veterans who are being housed and helped by this program. And I'm proud to say that in the roughly 3 years that it's been in operation, 61 homeless veterans are not homeless anymore. They're in stable housing. So we're very proud of that, and it's. We recently showcased Patriot House to some visitors from around the state who were government officials that heard about it and said, we want to learn more about that and possibly replicate it in our county. And so we're very pleased that's catching hold in other places. And
as I understand it, it's a home that was completely renovated with community partners, right, chipping in goods and
yes, absolutely.
Labor.
It's an old Victorian house that was completely gutted and remodeled for the mission, and a tremendous percentage of the cost of doing all that was through community donations. For example, all of the furniture donated, all of the appliances donated, the kitchen cabinets and everything in the kitchen donated. So a tremendous community outpouring for that initiative, and it's very successful and it's running great today. As of today, I think there are 5 veterans living in there right now. At some point in their journey from living on the street to going to stable housing.
And what's the capacity in terms of beds?
We can house 8 veterans there now. The house would handle more if we renovated more of the house, but we thought 8 was the right number, and it's proven to be the right number because it fluctuates anywhere from 2 to full. And so, you try and right-size what you're doing in this regard, and so far it's been right-sized for that.
And I've also heard that they have that you bring in services for the veterans who maybe in terms of counseling or other types of therapies and so on.
Yes, but it's not so much bring into the house. We found that taking them to the services is a better option, and so that's what
just in terms of confidentiality, you mean? Or?
Partly, the services are more available from a scheduling standpoint when you take them to where the services are, rather than rely on a home visit per se. And we get a lot of questions around the city of Kingston in particular. People who drive by during the day, they don't see anyone there. They say, well, there's nobody there. Where are they? Well, yes, there are plenty. They're there, but they're just not there now. They're out doing what they need to be doing to get from homeless to stable housing, whether it's their physical health, it could be their mental health, it could be substance abuse, it could be employment, combinations of these things. But every veteran has a different set of issues that causes homelessness, and so they're out and about every single day attending to those issues so that they can move on to their first apartment.
So it's designed as relatively short transitional housing to move veterans back into their lives.
It is absolutely transitional. It's not designed that they're going to stay there for a long time. We go to great pains to make sure everyone knows there isn't a hard end time. It's not just 90 days or 120 days or 60 days. It's when you're ready to make the next step. That said, all of the case management, the casework that we do with these veterans is designed to get there in about a 3 to 4 month period. And if it doesn't get there, then there's probably something's not quite right. Either the services the right services aren't being brought to bear, or we have had some cases where veterans are resisting, for whatever reason. So you have to get them to come around to the idea that this isn't where you're going to stay long term. Long term, you need to be in your own place, and we're going to help you get there.
Just out of curiosity, does your agency offer any support groups or those types of things to prevent people from falling into homelessness, or maybe with other issues where veterans can get together and talk through these issues?
Not so much on the homeless angle, Vince, but there has been, and this is a very recent development, there are, I think, 2 Legion posts in the county who wanted to reach out to the veteran population that had a need for peer support, and are running peer support groups in their posts. Saugerties is one for sure. I'm not sure about the other one, but that historically hasn't been available, and I think you could probably, I think it would be accurate to call that that's kind of in its infancy around here, but I think it's starting to take hold.
Well, we find there's a lot of evidence to support the benefit of peer support services, whether you're talking about helping with chronic disease management, mental health issues, substance abuse issues. The peers are extremely valuable in helping people not only address their issues where they are at the present time, but to help them get beyond so that they are progressing on the path to wellness. Whether it's physical or mental wellness. So certainly having your peers who understand what it was like to serve or to be deployed or what have you, that would be an extremely valuable, I'm sure, service for these
Absolutely.
veterans.
Yeah.
And I'd be remiss if I didn't mention that for the VA's mental health providers, they do a lot of that. There's at least one a week here at the Kingston Clinic, peer support group, and I think there's numerous up at Albany, because there's obviously more of them up there, and they serve a greater area. VA recognized a long time ago that peer support was an important component.
Yeah, and even the social connectivity that comes with it, establishing friendships and connections to one another, that comes into play in almost every aspect of health and mental health, and we see it over and over again that social connectivity is such an important factor in health and wellness.
Veterans can have conversations with each other that someone who's not a veteran could never have with a veteran.
Absolutely.
Right.
You can get away with open, really raw, open conversation vet to vet, because you have the
shared
ability to do
experience.
that.
Yeah, you've been there.
Right.
So, Steve, getting back to the VA health services, we've all heard in the news stories about the challenges that exist in the VA system and some of the problems. Have they, by and large, been worked out? Are they across the board? And how are they affecting people here in Ulster County, veterans here in Ulster County?
It's difficult for me to characterize the national condition here. I mean, we've all seen the reports, and the Phoenix VA was the poster child for what was wrong with that system. And honestly, I couldn't tell you whether Phoenix has solved their problems or not. But I think here's the important takeaway on this topic, and I do get this question a lot. Stratton VA Medical Center in Albany was never part of that problem. Not once. I will tell you that I can't count on one hand. I don't need all my fingers on one hand to count the number of complaints that my office receives about Albany VA Medical Center. And if you think about the thousands of vets and the thousands of visits every year that all that represents, I think that's pretty remarkable for a large bureaucratic behemoth that VA is. That our local VA Medical Center performs like that. And I'm a user of that hospital as well. And I can, on my own limited exposure, I feel the same way about it.
Mm-hmm.
It's great to know.
They do a good job.
Definitely give credit where it's due.
Right. And you ask yourself, well, how does that happen? How do you have great success in Albany and failure in Phoenix? And my only answer to that is it's got to be the local leadership.
Yeah, and you see that even in the private sector with businesses,
Sure.
right? You can have with some of these chain businesses, you can have a great experience in one restaurant or one store or one division, and then you go to the same company, completely different attitude and culture existing within a building.
And it wasn't so long ago that I didn't have kind words to say about the VA hospital just to our south, which is called Castle Point. It's in Beacon. And a lot of our vets from the Highland, Plattekill area prefer to go there because of the distance. Not a lot of good things to say about Castle Point, but in the last year we've seen a noticeable turnaround. And it's been because there has been a leadership change there, and it's made a difference.
Now, do these hospitals offer the full range of services? I mean, pretty much what you would get in a major hospital system?
Absolutely, and then some. I think I would say everything with the exception of dental care. That's the one exception that VA doesn't have robust capability with. Actually, they have strong capability, just very in small numbers, in very small numbers. Mm-hmm. And so they will only give dental care to veterans who have a dental condition directly related from their service. Otherwise, dental care is an open market situation for veterans.
So, is there any reason for a veteran not to take advantage of this basically free, excellent health care?
In my opinion, there are very few reasons why a veteran should not do it. But let's talk about why some veterans don't. All right, that are eligible. One is the distance to Albany. All right, if you're needing to see a specialist every month or every other month for something, you're going to Albany every time you need to do that. And for some people, it's either just an inconvenience or it's just prohibitive for them for whatever reason. The other thing is some veterans may have comfort with their local providers, their private doctor, and don't want to switch. And in healthcare, you can't. It's pretty dangerous to have somebody treating you for one thing and then another doctor treating you for the rest of the things, and the two don't talk to each other. Right. Coordination of care doesn't happen automatically, and in this case, if the veteran isn't doing his own coordination of care, it won't happen, and that would be a point of danger of mixing and matching your health care with VA. So, other than those two things, I can't imagine why a veteran wouldn't want to take care of.
One of them is being addressed somewhat with electronic medical records now, where their doctors are more and more looking, operating from the same page in terms of.
VA is trying to bridge some of that with telehealth.
Right.
They do some telehealth with mental health counseling. They do telehealth with optometry or ophthalmologic. I'm not sure. I'm not saying that right. But there are a few specialized areas where a computer and a sensor on a cart. Mm-hmm. That if the veteran can be engaged to, that the doctor in St. Louis.
And that's a trend that's happening. We just had Dave Scarpino from Health Alliance in here last week, right? Mm-hmm. And talking about telemedicine advantages benefits that are being brought forward.
It's a way to solve the time distance problem, especially in the North Country.
Yeah, in rural communities.
Well, Steve, this is really, all of this is really great information. And of course, we can't thank our veterans enough for serving their country and our country and keeping all of us safe. And Steve, thank you very much for everything you do every day, you and your staff. We're really lucky to have
you. Thank you, Steve.
And
my pleasure. It's a great mission.
Yeah.
For your service.
And we're about out of time. It always goes too fast. You're listening to Healthy Ulster Radio. Tune in next week for more great information that you can use to keep yourself, your family, and your community healthy and strong. Bye, and see you next week.
You've been listening to the Healthy Ulster Radio Show, a community affairs presentation from the Ulster County Health Department, sponsored by Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network. Thanks for listening, and be sure to join us for another edition of the Healthy Ulster Radio Show next week.